a lot of people registered, so hopefully we'll fill in as we move along. One of the things I want to do is there's evaluations and a survey on the table, so make sure you fill the survey out before you go, because one of the questions is, do you tend to register for these events and then not attend because you know we're going to send you all the materials afterward? And I'm wondering if that's starting to happen. I'm Barbara Lee Van Horsen. I'm the experimenter here at the Momentum Center, where we're creating a community where every person is fully visible and connected. We do that in a couple of ways. We provide social recreational programs for people with mental illness, addictions, and disabilities for $1 a year. And we address the social determinants of mental health through community conversations, like our town hall tonight, and through cultural immersion experiences. So really excited about our town hall. We launched a series on mental health and a variety of things that impact our mental well-being. So tonight we're going to talk about mental health and housing. We all know that there's a housing crisis in this community. We need to address that. But there's also a psychological toll, an emotional toll that takes. And so we want to talk about that impact, housing instability, housing insecurity on our mental well-being, as well as addressing the stigma of being unhoused. We have a fabulous set of panelists tonight. We have Jessica from Community Action House, Brian from Good Samaritan, we have Tim from Community Mental Health. Kendra, hopefully, is just trying to find the right building. She's from DHHS, and Josh from Love in Action. So we're going to hear from all of them in just a moment. But first I want to go over our agenda and our ground rules. So we always start with this. First of all, just to let you know what to expect tonight. We're going to start by going over those ground rules. Then we're going to hear from each of our panelists. They'll have 10 minutes to talk to you about how their work intersects with this topic and what they're seeing around mental health and housing. And then we'll have a Q&A opportunity. So great opportunity to ask all those questions that are in the forefront and the back of your mind. And then they're actually going to join you, and we're going to break into small groups so that we can talk about what we're learning, what the impact is, and what we can do as individuals and as a community to impact our topic tonight. So we always want to leave here with action items, not just talk about it. Talking about it is an action, but what's the next action after that? So our ground rules. First one is honesty. We don't get together to debate. This isn't about being right or wrong, but about being willing to share our experience and our thoughts, and to be able to listen to the experiences and beliefs and thoughts of others. Equality. We have a wonderful set of panelists tonight who have a particular set of expertise, but all of us are equal and valuable contributors to the conversation. Respect. We all have preconceived ideas, and they can get in the way of our listening to each other. So we want to be aware of that so we can remain respectful at all times. Active listening. It can be really difficult, especially in our culture these days, to actively listen to people. Often there are distractions going on. We're thinking about our phone. And mostly we start thinking about what we want to say instead of what's being said. So I want to challenge all of us, including me, to give our attention to whoever is speaking. And we'll all have an opportunity to talk. Responsibility, we all have hot buttons. They can be triggered unintentionally. So if that happens, we want to be able to name it without blaming anybody else for it, taking responsibility for what we think as well as what we feel. And finally, it's a shame-free zone. Shame never helps anybody grow and develop. If anything, it just pushes negative stuff deeper underground to fester. So this is a safe place for people to express themselves and to ask those questions and to not worry about being shamed for it. So I have to ask you, is everybody okay with those ground rules?
Yes. Yeah.
Anybody going to have problems with any of those ground rules? Okay, good. Then we can move on. I want to introduce our first speaker, Jessica Presley from Community Action House.
Thank you for coming. I'm Jessica Presley. I'm the Senior Manager of Housing Access with Community Action House. So a lot of people might recognize or have heard of the Homeless Street Outreach Team, and that's part of what I help oversee. So we're going to spend just a little bit of time rethinking that link between mental health and homelessness in particular, because our group and our team works with people experiencing HUD-1 or unsheltered homelessness living outdoors. So a little bit about who we are. I'm not going to spend a lot of time. You can go to our website to learn a little bit more. But we're basically a locally founded and funded nonprofit. We've been around since 1969, and it was a group of people that just wanted to find a way to create a welcoming space for people experiencing different struggles in life. We have about 70 plus staff and over 2,800 volunteers, some I see in the audience today, that really help impact and provide those services. So what we kind of do, a quick overview, is we nourish, equip, and empower. If anyone's heard of our food club and opportunity hub in Holland, down on Paw Paw, that's a great place for people to get healthy food access. We also have our community kitchen down in the Holland area, Lakeshore Food Rescue, Holland Community Garden. Equip, what I'm going to spend some time talking about, which is our resource navigation and our street outreach, and then our partnership with First United Methodist Church and our refresh program, and then empowering people. So we want to not get them connected with the healthy food access, address some of those other barriers, but then hopefully build on some stability for them going forward. So we do it because we recognize that a challenge in one area often intensifies challenges in other areas. So we really want to take kind of a holistic solution and approach to addressing all the different challenges that somebody might be experiencing. So again, go to our website if you want to learn more. It's a quick elevator speech, I guess. So the equip through outreach and housing access, which is what I'm here to talk about. So we have our outreach team. This is a group of about 8 individuals that work together to meet the needs of unhoused neighbors. We really focus on trying to connect with people who have a hard time connecting to some of those mainstream resources, but providing really housing-focused case management. In 2024, we had 118 unhoused neighbors work with us to find stable housing, and we had 41 individuals work with our recovery coach. So we really try to meet them where they're at, find out what those needs are, and what those next steps forward could be. So rethinking a little bit of that link, that kind of that mental health and housing, which is why we're here. So we're going to start with one of the big myths we hear. Homelessness is primarily caused by mental illness. Actually not true. Majority of unhoused people do not have a serious mental illness. Some of the mental health challenges are part of the story, and it is definitely more prevalent in people experiencing particularly unsheltered homelessness, but that's not the case. Actually, the national statistics show that about 1 in 4 people experiencing homelessness report a serious mental illness. That means 3 out of the 4, the majority, do not. And so that it can become a really big challenge when we're trying to figure out what are those solutions for people moving forward. Again, it's a higher prevalence in this population, but again, not the majority. More often, homelessness happens when a personal crisis meets a broken system. For a lot of our guests, it's lack of affordable housing in the area, poverty and low income, a job loss, medical, divorce, domestic violence is a huge one, particularly for women. These are all factors that often lead, but can cause more mental illness down the road, but these are typically more likely the causes than just mental illness on its own. Now, a lot of people have risk factors that place individuals more at risk for homelessness. Again, some of those things we talked about, mental health challenges is certainly in there. But many individuals experience these type of combination of risk factors and are able to stay housed too. So it's not just the unhoused community that's experiencing this. So why does that whole myth stick? Because often it's what we see. If someone is confused, they're talking to themselves, you see somebody having like a mental health crisis out in public, because again, our unhoused neighbors don't have private spaces for these, we notice that. And when we notice that, those visible moments can kind of lead us to believe that most people are experiencing homelessness have a mental health crisis. But again, that's not true. So we have a lot of people, again, about that 3/4 who are living in vehicles. They're going to work, they're going to school, they're staying with their families, couch surfing is what we call them. They remain mostly invisible, and that's why we don't necessarily think of them first when we're thinking about people experiencing homelessness. So what can actually make mental health worse is homelessness. So imagine if you're trying to like manage all of your life. For me, I have to use my phone to even keep track of where I'm supposed to go. Now you're trying to do that without a place to sleep. You don't know where you're gonna eat next. You don't know where you're gonna shower. You can't just go buy a gallon of milk because in the summer, where are you gonna store it? You're constantly on alert and in survival mode. So often those mental health challenges can begin or get worse because people are experiencing homelessness versus the other way around. That stress, that isolation, the danger of living without a home increases mental health challenges for people. So again, nationally about 1 in 4 people who are homeless have a serious mental illness. That increases though for people who have been homeless for a year or more to almost half. The challenge that we are talking about, if you're thinking you're living in that survival mode, constantly trying to figure out where you're gonna sleep, the longer you do that, the higher likelihood that if you had even a mild mental illness or mental challenge, it will increase. So our goal on outreach, and a lot of these partners here, get people off the streets and in housing as quick as possible to hopefully lessen that effect. So again, navigating that mental health condition is difficult under any circumstance, but again, I want you to think about what you would be like right now if you were trying to do your daily life, show up where you volunteer, whatever it is, without a place to sleep. You're not sure where you're gonna eat next. You're not even sure where you're gonna go to the bathroom, a luxury many of us probably don't even have to worry about. Now you add a mental illness on top of it. We put so many expectations on society in general, but for people experiencing homelessness to be these like perfect functioning members of society, taking away all of those, they're constantly worried about where they're gonna sleep, where they're gonna go. Are they gonna get in trouble that night? Can they make it to their job on time without a shower? If you add some mental illness to that, it makes it even more challenging. So navigating mental health condition is difficult again under any circumstances, but without that safe place, it becomes harder. Oftentimes for mental illness, we have opportunities that we can connect with many people here, like community mental health, but there's challenges in that too. Treatment programs often require insurance. If you don't have insurance, you're not gonna be able to get connected. Transportation, the paperwork needed, the barriers can be impossible to overcome when you're unhoused. We often forget that. Ottawa County has extremely low housing vacancy rate. It's very, very low. If I can't get that 75% who are functioning at what we would consider more standard, they're going to their jobs, the chances of getting somebody with an extra mental health illness, very challenging. And then without housing, if anyone knows the Maslow hierarchy of need, we want to meet those basic needs here at the bottom. It's very hard to recover from that more serious mental illness when you don't have a foundation of safety and stability. So if we buy into that myth that we talked about, that mental illness causes homelessness, it can lead us into misunderstanding some of those other real causes. We'll often overlook effective solutions. It can stigmatize people who are simply struggling with affordable housing. It puts us in a box that is one we need to focus on, but it can leave out so many other opportunities for her to try and navigate how to get people into housing. So how do we solve housing? Pretty straightforward. There's not a one-size-all-fits approach, right? We can't just come up with one thing that's gonna solve all of this homelessness. This is a really just intricate graph to show that there is more homelessness where there's less housing. The higher costs in housing, the more likely you are gonna have homelessness. And so you add in things like the mental health struggles people face and all of these other factors, makes it very challenging, and we're only gonna get worse. And so outreach for us, one piece of the puzzle, we work with a lot of the teams here to help navigate that. It also requires that lasting progress with a coordinated system, different partners working together to navigate that. And then one thing that's also important to remember, if we can help our neighbors who are experiencing homelessness have a safe, it's actually better for our community. It's cheaper on the systems, they reduce the pressure on hospitals, the other systems involved creates a stronger community for us, few emergency services trips, all of those things make us have a better community if we can get those who need housing into it. Okay, got it done in 10 minutes, right? All right, and then this, again, if you want to learn more about about Community Action House. You can scan a QR code, it takes you to our website, but there's lots of ways to be involved, volunteer, give. I'm sure my development department would yell at me if I didn't say there's donation opportunities. There it is, and I think we're good.
All right, thank you. Thank you, Jessica.
I don't know if I
Now
can
we
follow
get
her.
to hear from Brian DeVos from Good Samaritan Ministries.
Stand up too, she
Yes.
outdid me, I think. How do you do this side? Which side? This here?
Nope, there.
Nope. Here.
Right there.
Ah, got it. Look at that. We've been around since 1969. By the way, I'm Brian DeVos from Good Samaritan.
Use
Sorry,
the
I forgot
mic.
to introduce myself. All right, Brian DeVos from Good Samaritan. Sorry, I forgot to introduce myself. We've been around since '69 too, and it was a similar start to Community Action House, and we work closely together, by the way. Our mission is to end poverty and homelessness in Ottawa County, which is a big mission, and will probably go on for a while. There you go. We are the central intake for housing questions and referrals, so we're what they call the HARA, which is a Housing Area Resource Agency, and that means when people are looking or when they're homeless or on the verge of homelessness, they can call us and we can look at resources in the community to help them get housed and also assess them for eligibility for our services. And so we get over 4,000 calls a year, and we probably can only serve about half of those. So there's a huge need and it continues to grow. We also do a lot of referral to other resources in the community, like some of the folks here at the table and others in the community that provide services to help individuals who are homeless or on the verge of homelessness. And faith-based or public, whatever we can find, we work with to help us to help our clients. End goal is to serve them. We also have the home for the Lakeshore Housing Alliance, which is a continuum of care, which is a big word for helping access resources to deliver services in the community. So we're the home of Lakeshore Housing Alliance for Ottawa County, which is also very busy these days. We have some programs. They have names, and they're all these. There's a lot of acronyms in our world. It's called Rapid Rehousing. So this is housing navigation. So when people call us, they're being evicted. We put them on a list to try to find a place quickly so they don't end up homeless, and then sometimes have to do things to help them be housed during the look, and then help them move into an apartment in a quick fashion so they don't remain unhoused, I should say. So a lot of that is financial support, and we work with about 2 to 8 households a month in that program. And then we are the assessor for the housing choice vouchers in Ottawa County. We just got some good news that they're probably gonna come out again next this month, actually, end of this month. And if you don't know what those are, it's a voucher that a family with a low income can use and to find any apartment in the community, and it pays a portion of their rent to help them to be able to afford the apartment that they're looking for. Those have been on hold. That says officially they were put on hold since July 1 of 24, but actually we hadn't gotten any referrals. I think it was November of 23 or somewhere in there, September, October, November. So it's been a long time. So those really help folks because of the issue of not being able to afford housing in Ottawa County. And then this is just some CHP, it's a cute community housing project, and so we work with different percentage of income for families and their different capacities of what they do to help families with application fees, security deposits, utility deposits. A lot of times landlords have different application fees and processes for clients to go through, and so we help them to overcome those barriers. A lot of the folks that we work with are in the ALICE population that don't have extra money, and one big crisis could put them in a really difficult situation. So those are a couple more of our programs. And the guiding principles are we help people access needed services, and our intake department is really great at working with others and looking for services. And we develop housing stability plans, and what those are is we work with folks to help plan out over the next year or two or so, how they're gonna maintain their house or their apartment that they're living in. And that includes budget stuff, et cetera, planning, those kind of things. And then progressive engagement, a lot of folks that are in these situations don't wanna get involved in the system. They don't find it helpful a lot of times, and so we have to do it gradually. And we have to help them find records, because we have to have a lot of records to determine their eligibility. Trauma-informed approach, as Jessica talked about. If you know anything about trauma, we've all been through trauma of some kind, but a lot of these individuals we serve have had traumatic events in their life, and so we have to be sensitive to that and help them get through those traumatic experiences. Strength-based, we look at what their strengths are, work with those, and then we use what they call motivational interviewing, which is a trauma-informed approach to working with folks, which is good for anybody, not just somebody in a housing situation. Okay, and then we have our emergency eviction prevention program, which is for individuals in Ottawa County who are being evicted because they've had some kind of a crisis and they are facing eviction. And so we help them with back rent and coaching and education and finances and things to help them stay in their apartment and not have to go through an eviction. And then use just some of the qualifications, as we talked about before. There are several that they have to meet. And also a lot of data is collected from them to make sure that they're meeting those criteria. And any system somebody comes into can be overwhelming. And so they often need assistance just walking through the paperwork. And then I just got a few articles. I like to look at research. I came actually from a child welfare background, and so I saw a lot of the families of the kids that I worked with who also were low income and struggling with housing, which is a common thing. But this article talked about safe, stable housing and employment are key social determinants of health and critical for recovery from behavioral health news. And if you think about it, there's really not a lot of difference between mental health and physical health. If you had a surgery, you'd want to have a safe place to live to recover, right? So we should not always separate those. They're really kind of the same. They're health. They're all health, right? The other thing talks about exploring a link between housing stability and mental health. And this talked about eviction can have serious mental health repercussions. So obviously, even moving is stressful, right, to a new house. But this is also supports that. And then, while mental illness does not cause homelessness, the experience of homelessness exacerbates, as Jessica talked about, mental illness issues. And that's also proven in research as well. So that's all I'm going to say because I'm out of time. But thank you.
Thank you, Brian. And now we get to hear from Tim Pierce from Community Mental Health.
Good evening, everybody. My name is Tim Pierce. Asked you, I didn't get a chance to put together a slide deck for tonight. Although maybe I'll do a little dance while I'm up here. I did drink a bunch of water and didn't get a chance to use the restroom before no, but I wanted to start by sharing a story. A few weeks ago, my 15-year-old daughter came home from school before anyone else, which isn't unusual. What was unusual is that she called me. Her voice was tight and breathless. "Dad," she said, "the front door is open." Not unlocked, open. And you can imagine the alarm in her voice. In that moment, her sense of safety, her expectation of home being a secure and predictable place was shaken. My wife and I dropped what we were doing and raced home to check and see what was going on. And fortunately, it turned out just to be that the wind had blown the door open and the latch was forgotten. But that feeling of vulnerability, that your sanctuary might not be safe, lingers. And for far too many people in our community, that's not a temporary feeling, that's a daily reality. we see more and more individuals and families that are struggling to keep and find safe and stable housing. Some of them are sleeping in cars or in tents or couch surfing, doubling up in overcrowded houses. Some are one missed payment, one crisis, one mental health episode from becoming unhoused. And a couple of statistics I wanted to share that I found a little startling. Housing instability increases the risk of hospitalization for behavioral health crisis by nearly 80%, according to SAMHSA. Also, renters in Michigan have more than double the rate of depression compared to homeowners. And then last, children who experience housing instability have significantly higher rates of anxiety and depression across the lifespan than children that don't experience housing instability. So I think it's pretty clear that housing and mental health are deeply interconnected. And in my view, when we talk about health, we can't just talk about hospitals and clinics. We have to talk about where people sleep. We have to talk about where people feel safe. We have to talk about where people cry and rest and make plans and heal. I would say it seems clear to me that housing is healthcare. Housing is mental health care. And as someone who works in crisis intervention, I've seen over the course of my career how impossible it is to stabilize someone's mental health symptoms when they're living under a bridge or being shuffled between shelters or transitional housing, or worried that their kids may be removed from their custody because they don't have a fixed address. Jessica mentioned Maslow's hierarchy, and that was one of the first things that came to my mind too. So that's, for anyone that's not familiar, that's a theory that suggests humans have to meet certain basic needs before they can work towards meeting higher needs. So for instance, that we need food and shelter before we can work towards feeling safe, or we need love and belonging before we can operate to our fullest potential. And to me, in this instance, that theory really becomes a roadmap. So folks can't work on their recovery or employment or managing a diagnosis if their most basic needs for shelter and safety aren't being met. Housing, I see it as the foundation for wellness, and really without that, things tend to crumble. And for many of the people we serve, housing instability doesn't come alone. It often comes wrapped in stigma, which I think is equally important to consider. They're facing stigma around mental illness, stigma around substance use, stigma around poverty, around criminal records, around the idea that they're not trying hard enough. And the more layers of stigma that someone faces, what we would call intersectionality, the harder it becomes to access help. People internalize that stigma. They avoid seeking services. Sometimes they get labeled non-compliant, when I think what's really happening is people become exhausted. They feel invisible, they feel scared, and they are trying to survive on a daily basis. In my work, I think often of the idea of intersectionality as like a Rubik's Cube. And I really don't care for Rubik's Cubes. I was gonna grab one to bring tonight, and I think I've banished them from my home because they just frustrate me to no end. But they make me think of that because that you have to simultaneously address a number of different factors at the same time to try to come up with a solution, right? And I don't know if you've ever had this. I've seen where little kids sometimes get a kick out of pulling the stickers off of Rubik's cubes, and that makes, right, then you're really going in blind. And sometimes I think that's what I relate to when we're working with somebody that doesn't have stable housing, is to try to even get things to come together is feels like an effort in futility sometimes, frankly. So what can we do? I believe we need to build systems that recognize housing as a human right, not a reward for stability, that we can't treat housing as an afterthought to treatment, but as treatment itself, as an integral part of treatment. I believe it's very important that we advocate for more supportive housing, more peer-led crisis programs, more integrated care models that don't ask people to be stable before they get help, but help them get stable because they're receiving all of the kinds of help that they need. And we need to challenge stigma and policy in our agencies and in ourselves. So thinking of that story I told you in the beginning, that open door that frightened my daughter, I just want to take a moment to imagine being a parent who wants to offer that safe front door to their children but can't. Imagine being someone who's just left a psychiatric hospital or a jail and has nowhere to go to but the street. Imagine knowing in your mind what you need, stability, support, or healing, and not having a safe place of your own to lay your head that night. However, I have a lot of confidence in this community. A number of us are part of a coalition called Project Home that's doing some really important work, and just there's a lot of caring in this community, I believe. I think we can be a community that leads with compassion instead of judgment, and we can be the neighbors who educate others that housing isn't just shelter, it's dignity, it's health, and it's hope for the people in our community. So, thanks so much.
Thank you, Tim. Kendra, you made it! Yay. Kendra is here from Department of Health and Human Services. And you can stand there or you can stand up here, whichever you prefer, but standing is helpful.
The standing is helpful. Okay, all right. Good evening, good afternoon, whatever you want to call it. Yes, I'm Kendra Spander. I'm the director for the Ottawa County, Michigan Department of Health and Human Services, and I'm very honored to be on this panel with some pretty expert individuals with different agencies that are working hands-on with our unhoused population. So what does DHHS have to do with housing and mental health? Well, we have multiple areas that we work in with DHHS related to housing, and obviously, as already mentioned, basic needs. So first, we have the Assistance Payments Program, which is Medicaid, food assistance, supplemental emergency relief, child daycare, financial assistance. And when people say, oh, they're homeless, well, aren't they just getting cash assistance? Cash assistance is $428 a month. How many of you could live on $428 a month? I don't see any hands. We don't even have any housing for $428, let alone all the other things that you would need to survive. And those cash assistance cases aren't for single individuals, but for individuals with families. So cash assistance is not the answer. But we do have supplemental emergency relief. During the pandemic, we partnered with Good Sam and some other agencies to expedite our supplemental emergency relief process. However, many people applied, but were not eligible. I probably could show of hands. Why do you think that reason may be? Affordability. unfortunately, when individuals apply for supplemental emergency relief or if they have an eviction, let's say, they have an eviction notice, something happened in their life, there's a crisis, and they're gonna be evicted for whatever the reason may be, they come to our office, apply for supplemental emergency relief, and the first question that asks is, how much do you owe? How much would you owe if you were able to maintain the housing, which obviously we would like, right, people to maintain in their home. And if they do not meet the criteria for how affordable it is based on their income, they are denied. And that is the number one cause of denials here in Ottawa County is affordability. It is very rare that we have individuals that actually are eligible for that financial assistance due to the cost of their housing that they are currently paying. And the majority of that time they're looking at 30% of your income. And so for individuals that are only making minimum wage, if they're the only person in the household that has income, the likelihood they're going to meet that threshold is very slim to none. So they're coming to us already, probably not wanting to be there. There's not many people that come to the department and say, yay, I'm so excited to be here and get help. That doesn't happen. Now, do my staff do an amazing job of welcoming anyone through the lobby? Yes. And we see individuals, obviously, that are homeless. Actually, today in my lobby, I actually ran into a gentleman who was homeless and had all of his belongings with him. And you have no idea how disappointing that is for staff to not be able to do something right now for that individual. And so, unfortunately, at times you wonder, are you also helping to exacerbate mental health because you can't provide what it is that you would hope that you could provide to these individuals. So we have that. We have a staff that is called a Pathways to Potential worker who actually works out of Holland Heights in Holland School District, and she covers the Gateway mission. And so any youth that is placed at Gateway, not placed at Gateway, but is staying with Gateway, she assists those families as much as possible. And sometimes it is allowing food assistance that might help. That money might help them to be able to have money for housing, right? So we're trying to bridge those gaps. May it be that mom needs daycare assistance in order to maintain employment, or other service like Medicaid, like I said, as far as if they have medical bills and things of that nature. So we really try to bridge those gaps. So if we can't provide for housing, there might be other ways that we can assist. And so it's very beneficial that we have a case manager that can work specifically with those families that are staying at Gateway. Let's see what else. We also have, as Brian already mentioned, we were very excited that we received information that our family unification program, which is similar to the Housing Choice voucher, we also have those vouchers as well for individuals that are involved with us on the other side of my building, as we call it, Child Protective Services. And so if we have families that are coming to us for issues of neglect, we are able to also do the application process through our office, which is separate from the vouchers that are received for the general population. We also have what's called family resource specialists that are assigned to our cases that are bridge between Child Protective Services and our assistance payments program. So with that being said, I'm very hopeful. We have done some amazing work here in Ottawa County related to resources so that we are not removing children only for the reasons of housing. We have done an amazing job of either assisting with relocation and or keeping them at Gateway or other locations, using as many supports as possible. However, as we're talking about mental health, that really is something I think that is on the forefront. Like, how many times if we've had a family here in Grand Haven that is homeless, the question is, where do they go? And many times it's, okay, well, now we're going to put them in they have to go to Muskegon, to a shelter in Muskegon, or they may need to go to other locations. We've got small places that are very helpful, and we love them, but there's obviously always that need, even more need. And so we are addressing the mental health on the parts of those parents and the kids that we're serving. I have since we were sharing stories, I have a story of a family that we had not too long ago. Mom was living in an encampment, and dad actually. Mom had a brand new baby, and rumors had gotten out in the community, oh, if you call CPS, they're gonna remove your baby, baby's not gonna be able to stay with you, et cetera, et cetera. That is not what happened. My staff was able to go out and meet with mom. Mom was very, very concerned of that, wasn't willing to meet in the encampment. We actually met mom at a cemetery. Sat down with mom, had a conversation with mom, and said, what are you hoping for you and your baby? What is your plan? Do you feel safe? Speaking of, the safety piece. And mom was shocked, right? First she's like, why do you care? Are you taking my baby? She's like, I'm not taking your baby. Who told you we were taking your baby? We don't want your baby. And she was able to get mom into a shelter. Mom had some substance use issues. We're able to get mom into treatment with her baby, maintaining with baby, and mom has now been sober for 6 months, has housing, and the father who was living in the encampment now is also in treatment, knowing that he also needs to get clean. So there is some amazing work being done out there, and the concern is that, again, there's that feeling or that fear that families live in, thinking that the worst is going to happen. And so for me, the mental health piece is really, I think, cultural, and the way that we have treated individuals in the past, and that's hard to change. Change is hard, but really trying to embrace that. We obviously are involved, as Brian mentioned, on a lot of collaboratives. I feel like that's really the most important part that my department has, is really collaborating with agencies, ensuring that we're sharing information, knowing what resources are out there for individuals, and assisting them with not having that fear. Also just the fear of getting assistance from the department. At one point I think we had 296 individuals that were listed as homeless with our agency. That is not how many homeless there are. I mean, you may probably multiply that by 5. How many people are not willing to come and ask for assistance? So my ask, I guess that was kind of one of the things, like, what can we ask? My ask would be to share that when people are in need, that they are reaching out and doing what they can to get that assistance, and if they're feeling like there's a wrong door, bring them to another door, but really be that hand that can help individuals, and to try and minimize or eliminate the stigma that happens when people are getting help, and how can we share that burden all together. Collaboration is huge. So if you're seeing places in silos, maybe that's not the place that people should go. So thank you.
Thank you, Kendra. And now Josh Whiteberg from Love in Action.
And I'll just stay over here if that's okay.
Yeah.
Josh Whiteberg, Love in Action. I've been with Love for it's going to be 10 years in August, which seems like a very short period of time in my life when I look back. But yeah, 10 years. Love has been here for 40 years. Was started by Good Sam. In the dawn of history, 1983, a lady in Spring Lake by the name of Dee Padel founded us with Virg Gulker, who was the then executive director of Good Sam, and we were founded as a Love Inc. Kind of grew beyond that model, have a bunch of different ministries here on the north end of the county. 3 big things we do. Large food provider, over 10,000 clients in a given year. Launched a food club about a year and a half ago. But then 10 area pantries, food trucks, backpack blessings in the local schools, and a gleaning table on the north end of Grand Haven at the 1106 Fulton Street location, community garden on the far southeast side. So a bunch of different resources that are all funneling food all throughout the community. Our northernmost pantry is in Fruitport. Our southernmost is on the south end of Grand Haven, and we actually have one at St. Anthony's out on Green. So there's pantries open every day of the week somewhere in the Tri-Cities, and then the food club as well. We have a medical and dental center, free healthcare on the north end, and one of the touch points with this conversation in particular is that our medical center has an expertise definitively in the direction of mental health, and we have a nurse practitioner on our staff who serves and cares for those, and then a group of volunteer docs and care providers who are willing to help and when people are struggling with mental health. And so those chronic conditions, difficulties, all sorts of things are things we are constantly helping with. And then we have the 2 shelters on the south end of Grand Haven, Hope House and Harbor Hall. 25 to 35 people can live there at a given moment. So that's a little bit about who we are and a little bit about how I came to be in this conversation. When it comes to the actual conversation that we're talking about with mental health and housing, we do have a huge crisis. The people at this table, if you don't agree with that, I don't know how you don't agree with that. I mean, just get in my car afterwards and we'll drive around and I will help you agree. And I think we'll come away agreeing that this is a big challenge, and it's an economic one. There's a lack of supply, there's not enough houses for everybody, we know this, not an easy fix there. I guess it's about 7 years ago in 2018, Love started to make a turn. And the turn that we made was to decide that when we were looking at people that we were serving, we found them to be commonly sharing stories of isolation, difficulty, some mental health challenges, certainly. Some of them maybe not necessarily on the disorder. You were talking at the beginning about the difference between disorder and then anxiety, depression, and other things that maybe aren't on a disorder level when it comes to mental health, but are very much still contributors to difficulty. And we started to go, okay, how can we make a difference in providing community support here in the northwest end of the county? And we decided on a strategy that I'll call, we wanted to make things smaller with 10,000 clients. I tend to talk quick, don't I? Other people feel this way about me. Every now and then I get told, do you breathe? So I'll slow down and say, with 10,000 clients, we started to realize we don't have the small containers that we need to see actual healing and connection and relationship. One of my favorite quotes that came out during this time, a psychologist on the East Coast by the name of Dr. Kurt Thompson said, every person is born looking for someone who's looking for them. And what we found that was interesting about our clients is we started to think, you know what, they feel like nobody's looking for them. They often feel isolated. They don't feel cared about. And we started to think, how can we create communities, membership-based communities, self-selecting communities of people that are a part of each other's solution and relationship. And so Hope House and Harbor Hall probably spearheaded that with some of those relational-based connection spaces where we are not just a shelter, we're not just a bunch of beds, and we are not allowed, if you don't know this, in the city of Grand Haven, we're not allowed to be an emergency shelter, so we're not an overnight shelter. We are a long-term program for those who want to live in a communal setting for a period of time through recovery. And that doesn't mean substance abuse recovery. It means recovery from different things that have taken them away from maybe what had provided their housing in the past. And so we see tremendous success and tremendous connection. In fact, when I was getting ready for this, I was thinking about a few different clients that I could list over the years, one of whom came to us with a disorder. It was diagnosed, and we had a bunch of upstream providers that just said, we can't provide this, we can't provide care for this. I can think of somebody who had cancer and walked through that in our shelters as well. And watching them walk through the experience of being integrated and connected with other people who cared for them. And I mean this in a bilateral sense, people who are working together to be in relationship with one another. We watched that person go from being somebody who was just entering to being somebody who was really a coach to other people, a guide, a person who would sit in a group and say, this is what worked for me, maybe it'll work for you. And you can hear that voice. I don't want to be specific because I think both HIPAA and just common ethics mean I shouldn't. But when you see people around the community, I love to see folks who have walked through housing programs and walked through community connections and walked away feeling cared about and having seen that transformation that results. It's not that a program is transforming, it's not that a set of truths necessarily are transforming so much as the connections, the relationships, and the acceptance of what's actually happening in each other's lives and the relationships that develop from that point. That was really the basis for the community co-op that was founded in 2023, and we have 330 members in that group now, which are broken down into smaller groups through educational classes, but there's a real heavy emphasis on volunteering to be a part of it. So in other words, what that is like a food provider where the clients themselves are the volunteers themselves. And so it's an access point where everybody gets to serve on kind of this common ground and create connections. And we protect it. It requires protection. So we're not just inviting everybody to volunteer there. What we want to protect is that those people get to be a part of each other's lives in a healthy and long-term way. So the goal is to create those relationships and that connection inside of different sorts of education and food provision and health care provision sites, and including housing. In 2019, we launched what we call the Housing Ministry Collaborative, which is it's almost like an open market relationship between 9 churches in the area who all came together and said, we can pool funds to pay people's rent if Love will be the case manager. Since then, a group of private donors have gotten behind that project as well. I know in the last year we've helped 89 households stay housed in the Tri-Cities. We get about 1,000 calls a year for this, so it's a huge, huge draw. But these churches are all able to pay at the rate they are. So if somebody says, I need $1,200 to get my utility and rent up to date, which would be a really small number. Is that 3 minutes or 3 seconds? Okay, good. I can do this in 3 minutes. I started to see the 3 than the 2. That I thought, oh my goodness, this is like T-minus and we're going down. Anyway, these group of churches, Catholics, Wesleyan, Reformed, all over the map when it comes to denominations, they came together and they literally have one designated person from within their church that listens to the story, says, well, this month we can contribute $200 to this, or we can contribute $150, or we contribute $50, or we can contribute $600. And we've watched some of those commitments grow. It was 6 figures in allocations this past year as far as just direct rentals support and utility support and some mortgage support through that program. I think we're one of the only programs that supports River Haven right now, which is the 720 homes in the township south of here, mobile homes where people have some mortgages, but they also have those huge exorbitant rates of rent just for the lot that they're sitting on. So serving and providing care for those different groups, that's one of the things we've gotten, I think, kind of facile at doing. And we have a group of volunteers that volunteer to work with that group constantly and working to make sure that we are equitably providing the housing that people need all throughout the community. And if they come to us, this Housing Ministry Collaborative is, there are criteria, but the basic criteria is we want to create sustainability for a year. And so we're walking through providing case management so people can walk through that sustainability for the next 12 months. That's been a really interesting success, and it's been really fun to see the churches unite and combine around that. And you don't hear that sort of thing that commonly. They don't crow about it, they don't put it in the newspaper necessarily, but the Housing Ministry Collaborative has literally created housing for thousands of people just on this north end of the county for the last 6 years. I think I have like a minute left. All right. I talk too quick, that's what that tells me. What we want to be is a volunteer provider. We have over 1,000 volunteers in a given year, and we run these regular shifts of volunteerism. So across the north end of this county, there are 400 people working, almost all of them in a given week. They work like on a job shift. So it might be they're answering phones, it might be they're advising a person, they might be providing food, driving our Love in Action truck, which you see all over the place, Monday through Friday, driving around the community. Those are all volunteers doing this work. So we run about a 10-to-1 volunteer to staff ratio. We have about 35 staff, many of them part-time, but that larger part of our hours, vast majority, one year I can remember was 55,000 volunteer hours. So we are massively volunteer run by people just like the one sitting in this room and across the community. And it is a beautiful thing to watch. And we hear from our people constantly, from our clients, that one of the things that makes a difference is that they know somebody's giving them. They're there because they want to be there. Somebody is there serving them just out of a volunteer standpoint, and that means that somebody cares for them. So when I quoted that line about somebody, we're all born looking for somebody who is looking for us, I think that is the baseline that I would start when I'm thinking about mental health. We need to create communities of people. Here's my ask. That we need to create communities of people that actually are bilateral connection points, relationship building points, where we are changed by the person we're talking to and they are changed by us, and it's not a one-way street. And we see that across Love in Action developing over the last 7 years, and that's been a beautiful thing to see. Before you really do that T-minus thing, I'll drop the mic now.
Thank you, Josh. Leave this up here and open things up for Q&A. So, wondering what questions any of you might have for any of our panelists or all of our panelists.
Well, I'm going to be leaving soon, so I'll ask. I'm considering more like a group home setting. Can you hear me? More like a group home setting. And that would be, they'd almost like be renting the room. I don't know if that's actually something that works within your system so that not everybody gets evicted, but on a case by case, we can watch behavior and reliability and things like that.
Yeah, there are some homes actually, I know in Holland that do that and run out to individuals that have rooms, but there are some codes and things that have to be observed as well related to that, so zoning sometimes prohibits it, but, there are those resources available in the community.
And we notice that it's particularly helpful for those that are either making some of those lower wages, or we have a lot of people who are starting to age out of work and are making $9.67 on Social Security, and right now rent is just unaffordable. So we're seeing more and more seniors ending up in that boat who can't afford a single apartment, so we look for room to rents or SROs, single room occupancies. There are zoning laws, I don't know what Grand Havens would be or other areas, but we had, I think, about 37 people find room to rents in that 118 last year, and that was a really beneficial way to at least get indoors and start that process of stability, so that they maybe could hopefully move into an apartment once they got a job or access treatment, or were able to get to community mental health and do all that stuff, so.
Can I segue to one other
Yeah.
question? I see 3 people in the community who are mentally handicapped, not emotionally handicapped, and I'm not sure if they're falling through the net. I don't even, 2 of them didn't have caseworkers, so I don't know where to refer that.
Yeah, well, community mental health, we do have, an office up here in Grand Haven, and, you know, if the individuals are willing to come there and talk to someone, I would encourage them to come on in.
Because when I hear mental health, I think we're talking about actually a diagnosable, like an emotional condition, not a developmental condition. But are you saying it's an umbrella for both developmental and emotional?
That's correct,
Okay.
yep, we serve, all of that.
Okay, good to know.
Yeah, they cover developmental disabilities and cognitive stuff as well as mental health issues, right? See, anything falls under that, so there's services available for that. There's actually places to live for folks in those situations, so.
And oftentimes you can reach out to like the street outreach team for if those individuals aren't sure they're getting connected. Part of what they do is they go out into the community to try and connect with people and get them connected, similar to what you were talking about, going into the encampments, going into places where people are at, is to try and find out what the barrier is for that person to make sure they're not falling through the cracks.
And I was gonna say too, to Jessica's earlier point, we see at Good Sam a lot of folks that are on limited income, Social Security, $900 a month, aren't able to work too, is the other thing. They have a disability or, I know, some kind of a condition that doesn't allow them to work, and so we see that more and more. And I actually talked to 3 guys that were unsheltered, homeless downtown Holland. That was exactly their story. And I asked them, what would help you find a place to live? They said, if I could find something that was affordable, I make $850 a month in my Social Security. So that, we're seeing that more and more, and that's a huge challenge.
Other questions?
You're wired in here. So, if each of you think of the system that you operate in, and that's subjective, whatever that means to each of you, if you could change one thing, maybe 2, but one thing in that system that you think would make a difference in somebody's life when it comes to mental health and housing, what would that one thing be?
Think about
No,
that.
I was ready for you. You know, honestly, for us, it would be caseload size and ability to actually do the hands-on work. So as I mentioned, during the pandemic, our staff were obviously all at home working, and we had one individual, our lobby worker, who obviously the lobbies weren't open. And so he was actually going out to encampments when there was encampments that were shutting down and people had to move. And he went out with them and would bring his laptop and say, you know, let's look you up real quick. And he would check, you know, do you have a system? So it was that hands-on, because that we eliminated that fear of the door, right? Having to walk through the door. And so that is humongous for a lot of individuals, is being able to have that person, that face, and for them to care. And so we do have some of that possibility through joint ventures with entities and agencies, county money, that we can do those things, but people have to be interested and willing to do that. But yes, I would say case managers that are able to bridge those gaps of getting the services and going out and doing it.
This is kind of a crazy idea, but it would be interesting if we had a system that didn't base it on the program criteria, but it based it on the needs of the client. So in other words,
Sorry, that novel concept.
if it said, we have $5,000 to help you, how can we help you? You know, instead of, do you fit this, do you fit that, there'd have to be some criteria, obviously, but I think that's one of our frustrations, is sometimes you come in and they're just a little bit above the eligibility criteria, or they're just a little bit below and we can't help them, and they're just as needy as the other family that came in, you know? So I think that would be my dream. Anybody else got an idea?
And I mean, I share that, and I think there are some aspects of what we do, because we're locally funded, that's actually true, and that's a beautiful thing, when you don't have to look at one set of criteria and just say, well, you're not fitting this federal designation or whatever it might be. So two thoughts. One, I'll make my second thought going back to the previous person who just left, but she asked that question and ran out the door. But before I get to that, I'll say, I think my first thing would be to try to think of poverty as something everybody can do something about. I think the system I'm thinking I'm in is the system of the 55,000 people who live here. So I know you might be, Josh, asking that question about the local nonprofit that I serve. I would like to think of it as the community we live in. And then I think, you know, this will bridge into my second point regarding our friend who left, which is that one of the most successful, I think, long-term people who has walked through our housing process that I've observed, who now owns her own home. One of the bridge points for her was a person that she met through a connection at Love that took her in, that rented a room to her. And I don't think that they would have been zoned to allow that, but I don't know how you stop somebody from living in your house in an extra bedroom for $200 a month, you know, or whatever. I couldn't tell you about the dollar amount, but then it bridged that gap till they were able to afford an apartment, then they were able to afford a home, they have a child, they're able to live in health today because of that. And so I think it's not a one-size-fits-all, but there are people in partnerships like that could work. There are many that shouldn't work, right? There are many people that shouldn't take somebody else in. There are many people who maybe shouldn't live with somebody else in that way, but there are those who could. And so seeing those connections and seeing those relationships develop across our community and starting to think that we're not standalone people, we can't all just live individually and have this work, would be my number one thing.
I want one of all of those, so that would be great. I think to go a little off what Josh was saying is, you kind of touched on it, but there's so much stigma around housing and homelessness. We see it a lot with the outreach team, because we are typically working with those that probably have some of the biggest barriers in front of them, because they can't access mainstream services for whatever reason. And it just makes it that much more challenging when we're entering scenarios and everybody's like, well, they're just lazy. If they just get a job, they wouldn't have this issue. Not true. There's so much more complex issues in there, and it makes it so hard. Like, I joke with, I had to go get a new social security card for my son because we forgot to order it when he was born. New mom, completely forgot. I didn't read for a certain part right, so we had to go like 2 times to try and get it, and then we had to bring this one thing, but it had to be signed in the right spot. And I like to think I was a capable woman able to handle this, and I still struggled. So I just think of all those stigmas we put on people to be these perfect functioning members of society while they're living outside in a very traumatic event, right? This homelessness in and of itself is a trauma. And we're expecting them to just go do all these things and do it correctly the first time. And I give them this packet, they're supposed to go fill it out 100% and be right on time. And yet, some of us can't even do that ourselves. And most of us probably don't even have to think about where our next meal's coming from or where we're sleeping tonight. I'm assuming most of us have that luxury here. We've just put so much stigma on people to do that. And I would love to see if we can bring that system, and it kind of goes to the community talk of, can we do that together and help educate those that aren't ready to hear that? Because that's the other thing. There's you guys, I'm assuming, want to hear it, that's why you're here, but there's a lot of community members who don't. So how do we bridge that gap so that we can start moving forward together?
Yeah, I think Brian touched on kind of the eligibility or the restrictions around services, and that's something I think about, even about how people understand services or maybe don't understand services. So I had an opportunity to tour a peer respite center on the other side of the state about a year ago, and just a phenomenal center, and the lady that helped launch that program shared some of her experiences. And one of the things they would do is take folks from the emergency department who didn't necessarily need to be hospitalized but needed a secure, supportive place to be. And she talked about one of these individuals who had a serious mental illness, and it had been, they had been decompensating. The symptoms had been increasing over a period of months. And the staff asked them, well, why did you wait until now to come get help? And they said, well, I gotta be sick enough to go to the hospital, you know, and so I think there are those kinds of things, right, where our system doesn't always encourage people to say, hey, something's going on, and here's where I go to address it before it becomes a lot worse. And alongside that, just the idea that mental health treatment can take a variety of forms outside of the traditional mental health medicalized kinds of system, which is fortunate because we are really struggling to have enough mental health providers. So I'm really encouraged to see more services that are made available by trained lay people or people with lived experience or things like that that can really offer so much to folks who don't necessarily need you know, a MSW or a hospital or things like that. So just more of that would be great.
Great question. Any other questions? Oh, Kevin?
The videographer.
Yes, my question has to do with helping people with job training, because I've housed and helped a lot of musicians in Los Angeles as a fellow musician, because I was a building tradesman, I was a painting contractor. But oftentimes there are people who have different skills, but they don't know how to reconnect. And if we can get people from the community who are either retired or even some union people or former veterans, and find a way for them to come into the system working with community mental health to help to train people to get them on their feet so they have a focus about what kind of a future they might have.
There is the opportunity, if individuals come and apply for food assistance for what's called the FAENT, which is a lot of acronyms, but basically that's us connecting with Michigan Works. And so Michigan Works does a great job of trying to evaluate individuals' skills when they come in and do an assessment of what are their skills, what would they be good at, and providing possible paid training. So I know they work with Goodwill Industries as well. Actually, I think they're right across the street from each other. So that is a volunteer program if people decide to do that, and there is some incentives that are provided for individuals that are interested. And then obviously the same with our, to get cash assistance, they have to go through the PATH program, which is also set up through Michigan Works. So definitely some connections there. But I know that they also are doing a lot with Grand Rapids Community College, since that also has a location also in Holland. So definitely some of those connections are made if individuals are interested.
I think that's a good idea, and I think though it's not as easy as you think it is. And so I think when someone has been unsheltered or has gone through a trauma in their life, it takes a while for them to get to the point of being able to work, but I think it's a great idea. And it'd be wonderful if businesses would, and I think a lot of them do around here, would take folks in and do that. It would require, I think, some support as well, you know, from a caseworker or something to help them navigate that responsibility. But it is a good goal for sure. Yep.
Okay, we're gonna move into our conversation piece. So I'm gonna have our panelists join you guys, and I think we have a smaller group, so maybe 3 groups of about 6 people each. If we have maybe one group over here, one group over here, and one group on this side, and you guys can join one of those 3 groups. So we'll do some shuffling.